Okay, so shall I
Yashi,
start?
how are you? Yashi?
Hello,
はい、こん
hello.
にちは。こんにちは。
こんにちは、先
こんにちは。
生。
はい、こんにちは。お元気そうで。Looks good.
Shall I start, Prof?
はい、of course, please.
Okay,
はい。
so thank you for this opportunity, Prof. It was an honor being with you in Japan for the last 2 months, and now I will share my perspective in neurosurgery in Ethiopia. So for those who don't know Ethiopia, so Ethiopia is located in Eastern Africa, the Horn of Africa. So the capital city is Addis Ababa, and the total size of Ethiopia is 1 million kilometers square. So there are around 120 million people and above 80 ethnic groups, and it's in the low and middle income countries, and it's one of the most populated landlocked country on earth. And Ethiopia has never been colonized, and it has its own alphabet and calendar. So my educational background, 2027 up to 2021, I had neurosurgery residency in 𝑫𝒓.𝑀𝑖𝑘𝑎𝑒𝑙 Specialized Hospital in Addis Ababa, Ethiopia. And then May to July 2024, I had 2 months fellowship under Professor Ekokato in Fujita Bantane Hospital. So from 2022 up to 2023, I was attending neurosurgery at University of Gondar in the northern part of Ethiopia. And then from 2023 up to now, I am serving as attending neurosurgeon in Debre Birhan University, which is near to the capital city of Ethiopia. And starting from September 1, I will join the endovascular team. So my clinical interest is vascular, both open and endovascular. So the neurosurgical workforce in Ethiopia. So as a comparison, I have put 2 figures. So in Ethiopia, there are around 100 neurosurgeons for around 120 million people, which means around 0.08 neurosurgeon for per 100,000 population, or 1 neurosurgeon to 1.2 million population. When you compare it with the Japan, so in Japan there is 7.95 neurosurgeon for 100,000 population. In South Korea, 6.76 neurosurgeon for 100,000 population. In US, it's 1.82 neurosurgeon for 100,000 population, which means 1 neurosurgeon to 62,000 population. Globally, on average, there is 0.93 neurosurgeon for 100,000 population. And in Africa, on average, 0.11 neurosurgeon to the 100,000 population. So this is the 2024 paper. So it shows the growth of neurosurgical workforce starting from 2016 up to 2022. So the first one is on the high income countries, upper middle income, lower middle income, and the lower income countries. So when you see from 2016 to 2022, so on the upper high income countries, upper middle income countries, and lower middle income countries, there is a trend of increasing in the neurosurgical workforce. But in the lower income countries, it seems like slowly increasing from 2016 up to 2022. So when you compare with continent in African, American, Eastern Mediterranean region, Europe, Southeastern Asian region, and West Pacific region, including Japan. So when you see African, it's still in the bottom, 2016 up to 2022. It takes like a flat line. So comparing with US, American, Eastern Mediterranean, and European, it's on the upper side, and the Southeast Asian region, it's also higher than the African, but it's African and Southeast Asian are in the lower end of the graph. So it's also the same, which excludes Nigeria, because on this paper they found that there's a contradicting 2 figures for Nigeria. That's why they exclude Nigeria. But still, the figure is the same, and the bar is on the lower side for African and Southeast Asian in the neurosurgery workforce. So on this map, it's neurosurgeons per 100,000 population in the world. So in Africa, so here is Ethiopia. So it's found on the lower side of the workforce. So it's around 0.08 neurosurgeon for 100,000 population. So the neurosurgical centers in Ethiopia, so it's on all of the centers, it's under the Department of General Surgery with division in neurosurgery. So there are three neurosurgery residency teaching hospitals. Two of them are in capital city, Addis Ababa, and one is in the regional city, Mekelle. It's in the northern part of Ethiopia. So there are around 100 hospitals which can give service for neurosurgical cases. So those are public, it can be central or regional hospital, and private hospital. So the commonest neurosurgical cares are in trauma, tumor, vascular, spine, and pediatric neurosurgery. So there is no functional neurosurgery or minimal invasive neurosurgery, except for hydrocephalus, ETV, and sometimes in endoscopic transfemoral surgery for pituitary macroadenoma. So the Columbus Hospital is the largest hospital and the tertiary hospital referral which is found in the capital city, and it's a public hospital and teaching hospital. So there are around 520 brain surgeries in the last 10 months, and it's affiliated with three hospitals, other three hospitals in the capital city, and the sum of the procedure with this affiliated hospitals, it goes up to 2,000 to 3,000 surgeries per year, including pediatrics, spine, vascular, and trauma and tumor surgeries. The other is ACNS Stroke and Spine Center. It was inaugurated in 2022. It's a privately owned hospital. So it's the first hospital in the country for giving endovascular treatments. So this is Dr. Wonderson. He's a board-certified US board-certified neurosurgeon, neurocritical care, and interventional neurologist. So he came from US to open this ACNS Stroke and Spine Center. So it's the only interventional center. So starting from 2022, there have been around 760 procedures, both diagnostic and interventional, coiling and flow diverter, no web till now. So it's a private hospital, and it has boosted stroke care in hospital in Ethiopia. So it's also the first hospital to perform thrombectomy for stroke, and I will be joining them in September 1st. So this is the age distribution of Ethiopian neurosurgeon. So with age and sex and age. So most of the age distribution is in 30 to 14s, and as we have seen, as you can see it on the graph, there are few females, and usually they are below 40s. So the elderly or the previous neurosurgeon, all of them were male. So now we have few female neurosurgeons, and the workforce is in the 30s to 40s age distribution. So the top 5 most frequent disorder encountered by neurosurgeon in Ethiopia is traumatic brain injury, hydrocephalus, brain tumor, degenerative spine disease, and spinal dysraphism. So there are also aneurysm and vascular cases, but most of them usually they can't afford for private hospitals, and if they can afford, we can do in only one center, in private center, open clipping, and for endovascular, it's also in private hospital. There is no government hospital which can give the service for open or endovascular treatment until now. So the neurosurgical services and facilities in Ethiopia, so there is unequal distribution of resources by region and institution. So Tukur Ambassa Hospital, the referral hospital, it has MR, microscope, CT, and CR, but there is no neuronavigations and no service for functional neurosurgery. But there is limited equipments in the majority of the rural centers. This is the hospital where I am currently working in the Debre Birhan. It's one of the regional hospitals. So there is no CT scan in the hospital. So if you want to have a CT, we'll send the patient to privately owned imaging center, and then we'll get the CT. So there is no MRI in the region, so we have to send them to some other cities to get MRI. So this is the picture in the majority of the peripheral hospital and in the rural hospitals. Neurosurgical training in Ethiopia. So medical school, it can be owned by public or private hospital, and the duration is usually 6 months, 6 years for medical school. And specialty trainings, there are, as I've told you, there are 3 programs, 2 in the capital city and 1 in the regional. So it takes 5 years to be a neurosurgeon, 1 year of general surgery, and 4 years of neurosurgery training. So there are limited educational opportunities when you come to some aspect of neurosurgery, like functional neurosurgery, neuronavigation, epilepsy surgery, and the like, and even vascular neurosurgery. So there is also lack of subspecialist and proper fellowship in Ethiopia. So we have only 2 fully trained fellows, subspecialists, one for vascular, one for skull base. Otherwise, all of the others are being done by general neurosurgeons. So, and there's lack of rotation and detachments in the developed nation, at least to see those services that cannot be provided in our setup. The other thing in neurosurgical research is there are few research activities and there are only few neurosurgeons interested in research. So I think one of the difficulties or one of the factors is that there is no research methodology in the curriculum of neurosurgery. So I think it would have been better if we have a research methodology in the curriculum. In fact, we have to have one thesis. We have to prepare one thesis before our graduation. And the other, there's a lack of funding. If we have research, there's a lack of funding because of the economic crisis in the country. So it will be difficult to have this large-scale research. Otherwise, there are few neurosurgeons interested in research in neurosurgery. So what I can propose for future improvement is if we have if we can acquire microsurgical and endoscopic instruments and neuronavigation. So it was my first time to see neuronavigation when I go to Japan, and even endoscopic MVDs and the like. So the only thing that we can do in endoscope is ETV and endoscopic transfemoral surgery here. That is, we need to have more subspecialization because of the economic reason. So most of the neurosurgeon can't afford to go abroad to have this fellowship. So if you have this subspecialization program and fellowship, proper fellowship, I think it would be better for future improvement of neurosurgery in Ethiopia and also in Africa. Now there is more training opportunities like seminar, workshop, webinars, and fellowship. It will also give a boost for our service in this country, more research activities, more international collaborations, and we have to persuade the stakeholders to get some important gadgets for neurosurgery, and because we cannot depend on a donation for a long time. So I think it's better to persuade the stakeholders to participate and to see what we can do and to get more important gadgets for our service. So this is the image with the patient and physician conference. Here I am here, and it's Professor Yoko and Dan, Niraj, and Zulfi. This was my talk. Thank you. If you have any question.
Thank you very much.
Thank you, Prof.
Hi, Dr. P.
Yes.
So I think Michael, thank you very much for your good presentation. I think so. At the beginning, what you want to need maybe is such kind of a during your congress, maybe your congress, Ethiopia Congress, as doctors Japanese, we can visit your country. Then we can do the workshop or live surgery together with you. And another thing is, of course, maybe endovascular is very, very important in your future, I think. So just, right now you have just one endovascular doctor from United States, Axon Stroke Center you mentioned. So
Yes.
how you want to or you can improve that endovascular field? How do you think?
So most of the even there is no drug importers in the country to import the flow diverters and even coils. So usually he had to travel to US to bring that back here from US flow diverter and coils. Even I've even after that, it's very expensive for the people to afford that because one flow diverter it's around 1500 US 15,000 US dollar. So it's difficult to get it, and when you convert it in our local currency, it is a very huge amount of money. So it's difficult even to get that in our setup. So what he can do currently is he go to US, he get it from donation and from the hospitals, and he will bring it back with low cost. Uh, so one of the things that I can propose is maybe if we can access the drug importers, if they can provide us with low costs to our setup, maybe it will help our patients. And I think we can start from the simple one and the flow diverter and coils. Maybe I think that's cheaper than the web and the complex instruments or gadgets. So maybe if the drug importer or the manufacturer they can give us with a discount, maybe that will be a better option.
So what about the endoscopic procedure? That is very minimally invasive for patients.
Yes. So now in my hospital, there is no endoscope currently where I am working. So when I join on September 1st, ACNS, so I will start doing the endoscopic, even MVDs and endoscopic procedure. I will start my best to do this endoscopic MVD. We have some centers who have endoscope in private hospitals. In the government hospital, there is only flexible endoscope, only one hospital with rigid endoscope. So I will we'll try our best to start endoscopic MVDs and endoscopic even vestibular trauma surgeries
Yes.
with endoscope.
Thank you. So maybe I think today's the four moderators, maybe Yashin and also Atik, and this was maybe you can give some advice.
𝑚𝑖𝑘𝑎𝑒𝑙, can I have a question for you? In
Yes.
your institution, how are the microsurgical instruments?
So there is only one Leica microscope in the government hospital, in Black Line Hospital. So we have that from donation, like 10 years back. So in other hospitals, we have these low quality microscopes. So we have to adjust other instruments as in micro instruments. So we have to collect micro instruments which we got from donation. Otherwise, in government hospital, it's really difficult even to get these instruments purchased because of the financial crisis. And usually, the government they don't want to waste put that kind of money on healthcare. So we have to depend most of our gadgets from donations. So, but in Black Lion Hospital, we have one Leica microscope with micro instruments.
What about the basic microsurgical instrument like scissor or dissectors?
Yeah, for the basic, we have the basic microsurgical instruments in at least in the teaching hospitals.
How is the insurance coverage for the healthcare regarding neurosurgical procedure in Ethiopia?
So that's one thing. Think that's the important question. So we have healthcare insurance, but it covers very little amount of patients' expense in health system, and most of the people, they are not aware, or they don't want to have this healthcare insurance system. So usually the healthcare insurance system, it works in the government hospital, and there is no the system does not allow to have this healthcare insurance to work in the private hospitals. So only in the government hospital, and it can covers only around 2,000 Ethiopian birr, which according the current currency around 200 or something US dollar. 20, maybe 20 US dollar. That's the maximum that it can cover. 20 up to 30 US dollar according to the current exchange rate that the healthcare insurance can cover for the patient. So even if the patient have health insurance, so he has to pay some amounts in addition to the insurance.
Okay, so Atik?
Yeah.
I can hear. Atik,
Yeah.
we can hear. No, we cannot hear. Now, still we cannot hear. Still we cannot hear. Maybe Yashin first.
I think there is some connection issues with Dr. Atik.
Yeah, I think so.
Can I share my screen, or I don't have now question?
Okay.
So you want to start your presentation?
If you permit.
Yes.
You can click the share screen.
There is someone who's sharing his screen here.
Mika, could you stop sharing?
Okay. Yes.
Yeah.
Yes. Hello, dear friends and colleagues. Thank you, Professor Kato, for the invitation. So my talk today is about improving neurosurgery in my country, in my continent. I began with an introduction of myself. I finished my residency in 2020 in my hospital in Algiers, the capital, and I did my fellowship in 2023 in Japan under Professor Kato Sensei and Takezawa Sensei in Asahikawa. And now I am assistant professor in my department in Mohamed Lamine Dabakh University Hospital in Algiers capital. So for my country, it's Algeria is a large African and Arabic country. It's about 2 million square kilometers, and it's bordered to the north with the Mediterranean Sea and largely between Tunisia and Morocco. The population, it's about 46 million. We spoke for Arabic like first language, and the second French, and we have a local language Berber and some English. The World Bank classed Algeria in upper middle income countries. So this is the location of my hospital, which is one of the largest hospitals in Algiers, the capital. And it's a public university hospital with 1,020 beds. In my department, we do different neurosurgical subspecialties: skull-based, vascular, pediatric, trauma, and functional surgery, epilepsy surgery. We are about 18 neurosurgeons with 11 residents. And every year we have new residents from other African countries. Actually, we have 2 residents from Burundi. We have also a new pediatric oncology center now, functional in my hospital. This is the new building with the pediatric oncology center, specialized in the general surgery, pediatric surgery, and neurosurgery. In my department, we have 3 microscopes. The last one is the Divato with the ICG and the full HD recording system. And we have other materials for endoscopy and spine surgery and stereotactic Lixel frame and neurostimulation, inomed neurostimulation. This case in one of my last case, it's about the ACOM aneurysms, just to see what we are doing in my department. My experience in Japan helped me a lot to improve myself, and this, I think, a fellowship program is a must for all young neurosurgeon. Here we are dissecting Sylvian Fisher. It's a right ACOM aneurysm. I change my way when I come to Japan. I'm using the Transylvian distal approach now for all my aneurysm approach. Here the Cartier cistern, and here's the final clipping of the aneurysm. Here the final view. You can see we don't sacrifice any Sylvian vein, and you can see long small bone flap with put back without any defect. Donc, how to become a neurosurgeon in Algeria? We have to study 7 years. With the last year in internship with the 4 stage: medicine, pediatrics, gynecology, and surgery. And after that, we have to do a post-graduation national test exam. And the entrance in the neurosurgery, we have to study 5 years residency in the same center. We don't change the center. And after that, we do specialty exam. And after that, we do civil service 1 or 2 years in the rural part of Algeria. So this way, the government used to ensure specialties doctor in a rural area. I have to mention also that all medical education is in French language. I think that's a problem because we have a communication problem with the work, and we have a good surgeon, but they are not showing their work because of language barriers. The current situation in Algeria, the neurosurgery in Algeria began after independence in 1962, and actually we have 14 centers in public university hospital, and now we are between 300 neurosurgeons between private and public, and the most is in public hospitals because private activity is not well developed in my country. And most of big intervention are doing in public hospitals. Donc, you can see this picture, or the majority of population of Algeria is living in the north part. So the problem in healthcare is somebody getting sick or illness in the lower part of Algeria. I mean a big brain tumor or complex surgeries. We have to find the healthcare in big cities in Algeria, Algiers or Oran. So the travel time is about 4 to 6 hours with the car. And this is, I think, this big problem. So you have to see this part. There has been a rapid extension of neurosurgery training in Africa. So through various programs, and here in this picture, we see the average of number of training center per million. And maybe in Algeria, we have the highest number, about 14, but still not enough for my country. So what about research in Algeria? We have the financial problem to our study from the government or pharmacy group. And mostly we report a case or some retrospective studies. And also the cadaveric dissection is not allowed in my country. So what we need to improve neurosurgery in my country? We need, I think, a workstation to do pre-operative planning. So we use now some 3D viewer with the 3D reconstruction, and we need better equipment for all departments: neural navigation, ultrasonic aspirator, exoscope, 4K endoscope, and endoscope holder. I think it's very useful. Because in my department, we use 2 surgeons. So one for holding the endoscope and the second for doing the surgery. Developing the workshop with cadaver dissection in Algeria. So we have to go now for an international workshop, which is very expensive. And for endovascular, we're working together with interventional radiologists and perform endovascular treatment. Because in my country, the endovascular treatment are doing with on the radiologist. So the other thing, it's a local subspecialties training program by collaborating with other countries that have established programs, because I think it's give quality of treatment for our patient, and we must subspecialize, like I saw in Japan. And motivate neurosurgeon with better salaries, because in Algeria all specialties are paid with the same salary, and we all know that the working hours of neurosurgeon is double or triple than other medical doctors. And I think we have to move to medical English education to better communicate with the world. Thank you. So I will be always grateful to Professor Kato, who received me in her hospital. It's a great opportunity for me. Thank you.
Thank you very much. So excellent talk, I think. So Dr. P, you may start.
Yeah, I invite Dr. Biswas to give some comments or question for Dr. Felicie. Are you here, Biswas? I can have a question first regarding the education language in Algeria, because I know that in my country, Vietnam used to be a colony of France as well, and I know that France, they promote the francophone spread across the world of try to preserve the language in different
Yes.
parts of the world, and they offer a lot of like fellowship, 1-year fellowship programs. They have maybe 1 year in France, and the requirements is not too difficult to get to France to have the fellowship for 1 year, right? And how is that in Algeria? Are very like available often for Algerian doctors to travel to France to study?
Yes, it's about 1 to 2 hours in flight, so it's very near to my country, and most of neurosurgeons went to France for fellowship or for living. So I think it's a problem for us because I know our now all communication in English, so we have some problem with communication with the word, especially older neurosurgeon. Young neurosurgeon now they are learning more English language.
Yes, it's also difficult for the Vietnamese doctors here as well. They study French to come to France for 1 year, but after that they use very little of that language for their career later. So
Yes.
I agree with you that English.
I think, ma'am, over the French neurosurgeon, they speak English very well.
Yeah.
So yes, how many neurosurgeons? Because I missed your maybe presentation in your country. How many neurosurgeons altogether?
Around the 300 neurosurgeons, I say.
300. Okay.
46 million.
Mm-hmm. Okay. But through your video, I saw it with the A but your technique became much better.
Thank
maybe,
you, sir.
I think, yes.
Thank you.
I think maybe the who are willing to do more skillful skillful neurosurgeon, please send to Japan. I think, is it possible?
Yes, of course, of course.
Yes, please. I think maybe the middle age, the who will take supports the society, the neurosurgical society. I think not so many, maybe 50, 60 doctors. I think.
Oh, okay.
Mm-hmm. So maybe Dr. Liu, are you with us now? Okay. So, Dr. Atik, so maybe we can ask the current Dr. 𝑂𝑙𝑢𝑤𝑎𝑚.
Yes,
先生、こんにちは。こんばんは。こんにちは。So, do you have any suggestion? Because you are one of the leader, the young doctors. Please suggest him.
I'm sorry, suggestion about what?
Please suggest improvement of the in neurosurgery, his country, I think.
Oh, okay, yeah, of course. I think international collaboration is very great to improve that, especially when we are talking, exposing what we have, showing people what we have. We can also learn, especially also when people are going to do fellowship, they are learning more and coming to practice in their own country. But also what I usually call neuropolitics, better to speak also to do neuropolitics, to speak to the governor, the ministries, the member of parliament, tell them about the challenges we are facing so they can also help neurosurgery department, because sometimes neurosurgery is being forgotten. They are only concentrated on epidemiological things, diseases, and forgetting neurosurgery. Yeah, I think neurosurgeons should also have meetings with ministries, member of parliament, to discuss about how we can improve neurosurgery in local setting.
Yes, I think so. But is it not so easy? I think. How you can proceed it?
I think the only thing is to start with the Minister of Health, from him, because since he is the responsible of health in the country, from him, then he can help you to go. Like other countries, there is no law to use cadavers, or cadavers are helping people to practice, to improve their daily practice. So if you talk to the Minister of Health will talk with the Member of Parliament. If they accept that law of using cadavers, like in my country, we don't use cadaver, but we are now trying to push hard with Member of Parliament. If they can vote that law and we start to use cadavers also, and that will help us to improve again.
Okay. Yashi, please respond to the.
Yes, I agree
Kabla,
with
yes.
Dr. Kabulu, what you are saying about interest of the fellowship for young neurosurgeon, and we have to do cadaveric dissection. So it's same problem in my country. We are not allowed to use cadaver for dissection.
So you have enough equipment such as a scissor or bipolar or whatever. Do you have enough?
The basic we have instrument, and for my improvement, I'm buying my own instruments, micro instruments. Yes.
Micro instrument.
Yes.
Okay. Sylvia?
It's a problem also because it's too much. It's too expensive.
I see. Okay. Miss Sylvia?
Could you unmute Sylvia?
Yes, yes. I would like to congratulate Professor Kato and the organizing committee for such a great move to improve the neurosurgery in continent. So fellowship is the great opportunity for the neurosurgeon and nurses to learn how to improve in their respective areas, as well as international collaboration to share knowledge and skills from the advanced world in low and middle income countries. Congratulations for such great.
Okay, thanks so much. So maybe Dr. He?
Yeah, so we can move to the next presentation from Dr. 𝑂𝑙𝑢𝑤𝑎𝑚𝑎𝑦𝑎 from Nigeria to speak about neurosurgery in Nigeria. Are you ready, Mai?
Yes, yes, I am.
メイ先生、こんにちは。お元気ですか？
Hello, Sensei.
はい、はい。
Good to see you.
はい。Very nice to see you again.
Yes, yes. Okay. Thank you so much. I'm ready.
Yes, please. Go ahead.
I'll just try to share my screen.
Yeah.
Okay. All right. Thank you. It's my screen showing. Can everyone see it?
Yeah, we can see it.
All right. Thank you so much. Kato Sensei, thank you so much for this opportunity. I appreciate it, and it's a big delight and pleasure to see my friends and colleagues, 𝑫𝒓.𝑀𝑖𝑘𝑎𝑒𝑙, Kabulo. So happy to see everyone. And it's a big privilege to share with us, with the audience, what is happening in neurosurgery in my country, Nigeria. I'll start by talking about my country. Nigeria is the most populous Black nation on earth, with a population of about 230 million people. I'm very proud of the country. In terms of land area, we're just about 923,000 square kilometers, not as large as Kabulo's Democratic Republic of Congo, but it makes our country to be a densely populated country. It's a low and medium income country and has a very low human development index. And it is a multi-ethnic and multilingual country. It has been riddled by a lot of socio-political issues for most of its existence post-independence in 1960 from the British rule. But we hope that in coming years, we'll be able to overcome those issues, and with good leadership, we'll be able to sort out every one of those issues. Our official language is English, but we are surrounded by Francophone countries. To the west is Benin Republic, to the northeast Niger Republic, to the northeast is Chad, and to the southeast is Cameroon. And then we have the Atlantic Ocean to the south of the country. I will go on to talk about neurosurgery in Nigeria. The beginning of neurosurgery in Nigeria started with the return of Professor Latunde Odekun to the University College Hospital, Ibadan, in 1962. He trained in the United States of America. And on his return, he started up the neurosurgery unit in UCH, Ibadan. He was joined in 1967 by Professor Adelola Adeloye. And different neurosurgical units sprang up in different parts of the country. For example, Professor Samuel Oheagbulam set up one in Enugu in 1974. Professor Peter Benite set up one in Jos in 1980. Another one was set up in Lagos. And from this little beginnings, neurosurgery has grown over the years. And these are pictures of Professor Latunde Odekun to the far left of the screen. In the middle of the screen is Professor Adelola Adeloye. And then to the downside of the screen is Professor Oheagbulam. For those who know Professor Oheagbulam, Professor Oheagbulam has a good working relationship with neurosurgeons in Japan. So for those who know him, that's Professor Oheagbulam. From these little beginnings, we now have a total of about 161 neurosurgeons in Nigeria as at the last count in April 2024. This gives us a ratio of about 1 neurosurgeon to 1.5 million Nigerians in the country. The Nigerian Academy of Neurological Surgeons started in 2006, and it is a team of neurological surgeons, the aim of which is to promote the furtherance of neurosurgery in the country. Now, we have a varied caseload, as I will show in a few slides shortly. And a lot of times we face from our patients delayed presentations. A lot of times we have plenty of patients who have difficulties with financing their treatment because in Nigeria, most of our healthcare is being funded from private pockets. We have a national health insurance system, but it's still in its teething stages. And Nigeria being a low and medium income country, we have in the past years focused a lot on that's in the health sector. We have focused more on communicable diseases as part of our public health service delivery system. So neurosurgery does not take a high ranking on the national health insurance scheme. So a lot of times patients still have to pay out of their pockets for their neurosurgical care. And of course, we have lots and lots of trauma in our environment. Now, the Nigerian neurosurgical team has tried to overcome some of these challenges, and I'll talk about them in a few minutes. At the moment, in terms of training, we have about 15 training centers across the country, highlighted by the red stars on the screen. Northwestern Nigeria, Central Nigeria, Southwestern and Southeastern Nigeria. We also have, these are fully accredited centers, but we also have some centers with partial accreditation, which means that a resident can start training in that center, but we need to complete his training in a fully accredited center later on. The training in neurosurgery in Nigeria takes a total of about 7 years. You do 3 years of general surgical rotations through the different arms of surgery, including urology, anesthesia, cardiothoracic surgery, plastic surgery, and so on. And then after passing the mid-exam, which we call Part 1 in Nigeria, you move on to do 4 years of core neurosurgical training, at the end of which you write the Part 2 exam to qualify as a neurosurgeon. All right, so in terms of service delivery, our reach as neurosurgeons in Nigeria, we have a lot of general surgical procedures, pediatrics, a lot of spine. I work with a spine surgeon and most of my caseload is spine. We have lots and lots of trauma. And then some centers do a lot of oncology, meningiomas, gliomas, posterior fossa tumors, craniopharyngiomas. Vascular cases are also being done. A number of centers do clipping of aneurysms, but these are not very common the way we have other cases. Endovascular neurosurgery is almost non-existent. I understand that a private center in the country started up sometime last year. They have few cases. Functional neurosurgery is also almost non-existent in the country. Now, to help with training, we organize, especially from the Nigerian Academy of Neurological Surgeons, at least yearly courses. For example, in the picture you have on the left side of the screen, it's the pre-conference hands-on workshop that was held while I was in training in 2015 in Sokoto. And this has become like a norm, part of our conference. When we have our annual conferences, we would usually have a pre-conference workshop, which is targeted at residents in training and young neurosurgeons to help improve on their skills. Also, to the right of the screen, we can see advert from the Lagos Neurosurgical School. They also have courses from time to time. And this one, for instance, is a course on microneurosurgery, which is to be held later on this month. So these are part of the things that we do on the Nigerian scene to help increase our skills as neurosurgeons. So I've talked about service delivery. I have talked about training. I would want to talk about research and mentorship. Let me go to research. While I was still in training, one of the things we used to hear was, oh, we lack data from Nigeria, we lack data from Nigeria. But this is slowly changing. The trend is slowly changing. In the past few years, we have had a lot more of Nigerian neurosurgeons writing, especially young Nigerian neurosurgeons. As exemplified with this study, you can see in the top part of the screen, epidemiological burden of neurosurgical diseases in Nigeria. So we have lots more writing, research from young Nigerian neurosurgeons. Also from the Nigerian Academy of Neurological Surgeons, the Neurotrauma Committee has also been involved in doing a lot of research towards trauma cases in Nigeria, and we have a number of publications written. So this trend is, improving with more people going into research in Nigeria. In terms of mentorship, the Young Nigerian Neurosurgeons Forum, in collaboration with Women in Neurosurgery Nigeria. So now Women in Neurosurgery Nigeria, we are only 6. Our first female neurosurgeon graduated in the year 2014. And the 6th one graduated last year. So we were only 6 females in Nigeria. But we have this, our focus has been on mentoring young medical students and young doctors so that we can have more people choose to join the neurosurgical workforce. And so last year, we organized a neuroscience quiz competition for medical students. You can see the flyer there on the left-hand side of the screen. And this is something we hope to continue to do on an annual basis. The plans are on for the quiz competition for this year. And it has been a wonderful mentorship experience because the medical students we interacted with last year, we are still in contact with them. We are now seeing a number of medical students also interested in writing, in doing research work. And from time to time, I get calls from medical students wanting to join in one research activity or the other. So it's a very good opportunity that we have created in mentorship. Now, the last thing I'll talk about is collaborations. Different neurosurgical units across the country has different relationships with neurosurgical units outside of the country. For instance, the unit where I trained at in northwestern Nigeria, Sokoto, we have relationships with British Scale Hospital, Cape Town, with the Rabat Neurosurgical Center in Morocco, with the Neurosurgical Center in Recife, Brazil. And I know that other neurosurgical departments across the country has different relationship with different neurosurgical centers across the world. And the aim of these collaborations and these relationships is to help improve with transfer of knowledge, transfer of skill. So some of us will go to those centers, stay for a few months and return back home with more skills. So this is very, very important with improving our skills acquisition and in passing on knowledge to the next generation. The picture down there shows a team of Nigerian neurosurgeons at the WFNS conference in Cape Town last year. And this slide shows some of the collaborations that we have had. Like this is with the University of Nigeria Teaching Hospital in Enugu, with the Neuro Kids and with the Swedish African neurosurgery collaboration, doing low-cost surgeries for patients who cannot afford the treatment. And this is very helpful with skills transfer and so on and so forth. I had to put this picture because in this picture, this was my first time of meeting Professor 𝑘𝑎𝑡𝑢. This was the ACNS educational course that was organized as part of the CANS conference in Abuja in 2018. And we can see a great number of Nigerian neurosurgeons there. All these are helpful for us to increase our educational to increase our knowledge in neurosurgery and increase the flow of ideas, the exchange of ideas with neurosurgeons across the world. Now, in particular, what do I do and what are my interests and focus in neurosurgery? I have been involved in neurotrauma since I graduated in 2018, but my interest is really in vascular neurosurgery, both open and endovascular, and also in pediatric neurosurgery. And this slide here is just to show an interesting case that I was involved in last year, a patient with a neurofibroma with a massive scalp tumor that was excised. which I intend to write as a case report. And these are the kind of cases we see in our environment, very interesting cases that we need to share with the world. In two of the centers that I work at, this is just to give us an idea of the flow of the caseload that we have. And the center I work at mainly is the Imo State Specialist Hospital. And you can see that most of my cases are spine cases. But what I intend to focus on moving forward is on vascular and pediatric. And this is how I intend to do it. In vascular neurosurgery, I intend to push the frontiers for doing carotid end atherectomy. We have a very high stroke rate in Nigeria, and I believe that carotid end atherectomy will be very helpful to reducing the stroke rates that we have in the country. Also, doing bypass surgeries to help improve the outcome for our patients. There is a team called the West African Stroke Initiative. They are already in discussions with the Lagos University Teaching Hospital to set up an endovascular neurosurgery service in Nigeria. The talks are really underway, and we hope that before the end of the year, we'll have have concrete steps taken in that regard. I know some other neurosurgeons are also looking towards functional and setting it up in the country. So these are the things that we're looking forward to doing in the Nigerian neurosurgery scene in coming years. Now, in particular, in my facility, I work in southeastern Nigeria in Owerri. Apart from basic neurosurgical sets that we have, the following are the things that we still need to have, and we're still looking forward to getting them. We need to have a very good functional microscope. We need a neuronavigator. We would want to have intraoperative neuromonitoring for somatosensory and motor evoked potentials. I would like to have ultrasonic aspirator. I remember there was a case I was doing with my boss, a tumor case, and it was really very difficult. We couldn't suck it. We had to just end up taking a biopsy, which we feel that if we had an ultrasonic aspirator would have made things easier for us, for the patient. So these are the things, a few things that we need in my facility. Towards further improvements, I think that having public-private partnerships would be very, very helpful in improving the neurosurgical improving the neurosurgical service delivery to patients in our environment. This will help to cut down on costs and help patients access this specialized care. Now, the other thing I think we would focus on is subspecializations. As I've mentioned, I'm interested in vascular neurosurgery, and I know other people are interested in epilepsy and functional neurosurgery. We want to encourage these subspecializations in young neurosurgeons so that we can improve the service delivery to our patients. I also personally believe that innovations and creativity is very, very important. We may not be able to get all the high-tech equipment that we see in other countries. But if we can be innovative, if we can be creative, if we can collaborate with other scientific fields in the country, we may be able to come up with useful, less expensive things that we can use to give safe neurosurgery to our patients. And I'll give an example with the 𝑫𝒓.𝑀𝑖𝑘𝑎𝑒𝑙 shunt, which was developed by Indians. Before 𝑫𝒓.𝑀𝑖𝑘𝑎𝑒𝑙 shunt came, the only kind of shunts you could get are the ones from the US, Medtronic, and so on and so forth. These are very, very expensive shunts. But with innovation, with creativity, India was able to create the 𝑫𝒓.𝑀𝑖𝑘𝑎𝑒𝑙 shunt. And for most of us in developing countries, that is what we use for our patients with very good outcomes. So this is an example of how we can innovate and get less expensive alternatives for our patients, especially in low and medium income countries. So to conclude, Nigerian neurosurgery is developing fast. we need more resources to facilitate this growth. And then collaborations both within Africa and with the rest of the world will be definitely beneficial to us. To close, I would just want to invite us to our Ibadan conference. Like I said at the beginning, we started out from Ibadan in 1962. And to this year, we're returning there for our conference, our national conference. And we're also inviting you to the CANS Congress in Kinshasa in November. Thank you for listening.
Thank you very much.
Thank you, May, for very informative presentations regarding all the aspects of neurosurgery in Nigeria. And I can see that you have a lot of international networking with in Africa and also to the world. Regarding the residency training that I saw that you have a relatively long duration of residency with lasting for around 7 years, but you have to do 3 years for general surgery before 4 years of neurosurgery after that. What is the rationale for that in the education system?
Okay, thank you very much for the question, Hui. Like I said, the training in Nigeria has been focused towards general service delivery to the Nigerian populace, okay? And the health ministry feels that we have more patients having general surgical problems and communicable diseases and so on and so on. So that is where the focus has been, okay? But with the growth of neurosurgery, people now see that we have a lot of neurosurgical patients, but still the training is geared towards having a neurosurgeon that will be able to sort out general surgical pathologies, right? In addition to being able to sort out neurosurgical pathologies. Now that we are having an increase in the number of doctors in the country, the medical college that is involved in training is now beginning to think towards having neurosurgery go off on its own, such that you don't need to do the general surgical rotations before doing neurosurgery. But that is still in process. It hasn't been settled yet. But I'm sure in a few years, we would have a situation where we go in for only neurosurgery for about 4 to 5 years as our training. Thank you.
Yeah. And I can also notice the difference regarding the epidemiologies of neurosurgery in Nigeria with a higher prevalence of pediatric or congenital problems. So regarding that types of diseases, you have any proposal or suggestion for that field of neurosurgery?
That's for pediatric neurosurgery?
Yes.
Okay. Yes, it's one of the reasons why I'm interested in pediatric neurosurgery. We do see quite a lot of congenital anomalies, especially spina bifida. And as we all know, spina bifida is something that can be preventable most of the time. So one of the things we want to do as women in neurosurgery in Nigeria is to begin to have how will I describe it now? Educational webinars or educational outreaches, okay, to young females, to talk to them about use of folic acid, preconception folic acid, and so on and so forth. That's for the general public education. We also need to have more people to be involved in getting training for pediatric neurosurgery. As it is, I know of only one person who has done a full fellowship in pediatric neurosurgery in Nigeria. I'm not quite sure if other people have done, but I'm sure of one person who has done, and it's one of the reasons why I'm interested in doing a pediatric neurosurgery fellowship. And who knows, with more people joining the neurosurgical workforce, we may have more people who will be interested in doing pediatric neurosurgery fellowship training.
Yeah, thank you.
Yeah.
So May?
Oh, we have a Mikan raising his hand.
Okay.
Please, Mikan.
Okay. Thank you, May, for nice presentation and nice to see you after like 2 months. Our senior neurosurgeon in Japan.
Yeah,
So,
it's nice to see you too.
Yeah, my question, it's not a question, it's like suggestion. What's your comment to promote research in general in Africa based on especially neurosurgery on your experience, like the 𝑠𝒓 Natalja scholarship? So what's your recommendation or what's your comment on that?
So I didn't have that. Can you pick that again, please?
So my question is, what?
Can you just take it again, please?
Okay, what's your comment to promote research in Africa based on your experience on the 𝒓 Natalja scholarship? So what do you say about the importance or the significance of this kind of scholarship in Africa? Maybe it can be like an example in other setups. What's your comment on this?
Okay, thank you so much for that question, Mikhail. I'll just say a few things. I'm sure Dr. 𝑂𝑘𝑎𝑏𝑢𝑙𝑢 is here. He would probably say some more about it. So this question goes to talking about the efforts of the young African neurosurgeons with research and education for young African neurosurgeons. I'm currently the secretary of the Young African Neurosurgeons Forum, and our focus has been research and education. In terms of research, we have had a number of research webinars for young African neurosurgeons. And that was what we did in the first year of our tenure. In this second year, we have focused on having our young African neurosurgeons actually stand out to showcase their research work. And that is what the 𝒓 Scholarship is all about. So the 𝒓 Scholarship, Dr. 𝑂𝑘𝑎𝑏𝑢𝑙𝑢 will say more about it. It's an initiative by Dr. 𝒓 of Democratic Republic of Congo. And it's aimed at giving travel funds and registration for our Continental Association of African Neurosurgical Societies conferences, which holds every 2 years. It started it was thought of in Nairobi, Kenya in 2022. And last year, we had some people get the scholarship to go for the Congress of the DRC surgeons last year. This year, we are having young neurosurgeons from different countries in Africa being sponsored by this scholarship to be at the 𝐾ANS conference in Kinshasa this year, where they would showcase their research work. And how are we doing it? In the different neurosurgical societies, there are different conferences. We listen to the young African neurosurgeons present their research work at their conferences, and we pick the best 5 from those conferences to the best 5 that is now sponsored to the 𝐾ANS conference in Kinshasa. Dr. 𝑂𝑘𝑎𝑏𝑢𝑙𝑢, I'm sure, would say more about the scholarship. Thank you, Mikhail, for this.
Thank you. Thank you, Orsingarmi.
So thank you, May. So maybe maybe we will have a lot of discussion in November. Kinshasa Congress, maybe we can have a discussion about the WIN and also YNS, a resident, and the fellowship. So many sessions, I think, a discussion in November. Is it okay? Can you hear?
I'm sorry, I didn't hear that. Let me use my earphones to hear. I didn't get.
So in November, so the EU will have a great Kinshasa CANS, the biggest congress in Africa. Maybe during that time, maybe we can have a discussion about WIN and also the YNS plus resident session. So how we can improve the African education and also training system, I think. It was a great talk. Thanks so much. Yashin, you want to say something? Some suggestion to her?
I just want to thank her for her presentation and wish her the best for the future. Yes, neurosurgery in Nigeria.
Thank you.
So maybe not only 6 lady neurosurgeon, maybe in a few years, maybe the double or triple number, the female neurosurgeon, please.
Yes.
Yes.
Arigato.
Arigato, Prof.
Arigato. Okay, so Dr. P?
Yeah, thank you again, for the wonderful presentation. For the next presentation, I would like to invite Dr. Grace Combe to present the neurosurgery in her country, Tanzania. Dr. Grace, please.
Hi, thank you. Let me share my screen first.
Yes.
Can everybody view my screen, please?
Yes.
Yes.
All right. First and foremost, I would like to thank Professor Kato and the ACNS and YNS team for inviting me here. I'm very grateful to be one of the presenters today. I'll talk of the key milestones and strategies of neurosurgery development in Tanzania and across Africa. This is my hospital where I work. It is called 𝑫𝒓.𝑀𝑖𝑘𝑎𝑒𝑙 Orthopedic Institute. In a short form, we call it 𝑀OI. I have some few outlines. I'll start with my brief introduction and the country as well. I'll talk about this current situation of neurosurgery in Tanzania, comparative analysis of neurosurgery in Africa, challenges facing neurosurgery in Tanzania, needs for the neurosurgery in Tanzania, and our wish for the future improvement. Briefly, as I've been mentioned, I'm Grace Emmanuel Kombe, a registered nurse and a neurocritical care nurse, currently working at Muhimbili Orthopedic Institute, MOI, which is in Dar es Salaam, Tanzania. And MOI is the National Institute of Traumatology, Neurosurgery, and Orthopedics. And I have 20 years of practice as a nurse. Out of that, 14 years working at MOI, and currently I'm working in a neurocritical care ward for the past 6 years. I am from Tanzania. Tanzania is found in the eastern part of Africa. It is a lower middle income country. It has a land of square meter of 945,087. Tanzania is a result of unification of Tanganyika, which is the mainland, and Zanzibar, which is the island. The unification formed on 1964 to form the United Republic of Tanzania, where we became independent from the British on 1961. Tanzania has got only one national hospital, It has 5 zonal hospitals, with these are referral hospitals, and a lot of dispensaries are more like 8,000 and 176 district hospitals. In Tanzania, neurosurgery is still in its developing stages. The country has 5 major hospitals, as I've mentioned. Among them, Moi has been chosen to be the national hospital, which is the center of excellence in Tanzania. Moi has got only 362 beds, of which 90 to 100 are neurosurgical inpatients, while outpatient visit daily is 100 to 120 patients. Neurotrauma is the leading cause of mobility and mortality in young adults in Tanzania. So, followed by aneurysm, stroke, brain tumor, epilepsy, and pediatric neurotube defects cases are also in the rise. So, evidence-based neurosurgery reduces mortality and improves outcome and also reduces costs. So, Moi, as Center of Excellence, needs new knowledge, skills, high technology treatment, newly advanced treatment, and surgical procedures. Shortage of neurosurgeons in Tanzania further worsens the situation, which make many patients to have they have to travel long distance to seek appropriate care. So efforts have been made to address these issues through training programs for local doctors and increasing treatment in neurosurgical infrastructures. For the past 13 consecutive years, global neurosurgery course under the 𝑊𝑒𝑙 medicine have been conducted to teach young neurosurgeons from low-middle income countries using the real-time low-middle income environment at Moi, which is in COSEXA region, whereby young neurosurgeons and neuro nurses acquires essential and up-to-date technique and evidence-based management principles of brain and spine in Tanzania and Africa. When we do comparison analysis of neurosurgery in Africa, across Africa, the development of neurosurgery varies significantly between countries. There are countries like South Africa, Egypt, Nigeria, and others like Algeria, Tunisia, I forgot one, like 6, and Morocco. These are the leading in the field of well-established training programs, specialized hospitals, skilled practitioners. However, in countries like Tanzania, Kenya, and Uganda, there is still a shortage of neurosurgeons and limited resources for advanced treatment. So collaboration between countries, sharing of best practices, and investment in research are essential to bridge the gap and provide quality neurosurgical care to all the African population. According to former researchers, we have only 565 neurosurgeons in Africa, which makes a ratio of 1 neurosurgeon to attend 1.2 million population of patients, which is a very huge number. And also, it makes delays in delivering care to the Africans, and also in sub-Saharan Africa, you have only 79 neurosurgeons, which make a ratio of 1 neurosurgeon to 3.6 million of population. So we see there is still a need of overcoming the shortage of neurosurgeons in Africa. So we have some numerous challenges in the field of neurosurgery. These are shortage of trained neurosurgeons. Like in Tanzania, we have only 25 neurosurgeons. And out of these 25 neurosurgeons, 12 are in Moi, and the rest are distributed in those 5 zonal hospitals. And we also have lack of advanced equipment. We don't have adequate funding. We have limited access to quality healthcare in rural areas. We also have lack of resources and infrastructure that hinders the ability to perform complex surgeries, resulting to mortality rate for neurosurgical patients. So, speaking of population of Tanzania is almost 70 million, and you look at the number of neurosurgeons in total is just 25. So you see a lot of people are missing the proper neurosurgical care. So mentioning this will be addressing these challenges is crucial for improving neurosurgical care. Needs for neurosurgery in Tanzania, the first one is to establish advanced neuroendovascular treatment, and the other one is the establishment of functional surgeries, and the other one is the establishment of complex spine surgeries like deformity corrections. Also, advanced training to neurosurgeons and neuro nurses on the quality care to our neurosurgical patients. What we need for our future needs, or what we wish for our future improvement in neurosurgery in Tanzania. The first one is to strengthen international collaboration, as my other former speakers have been saying this, is strengthening international collaboration with the established neurosurgical centers globally by exchanging knowledge, training programs, and access to innovative technologies. And the other one is collaboration of government and non-government organizations so that they can secure funds for neurosurgical infrastructure like modern ICUs, modern operating theaters, etc., and the diagnostic images. Also, the other one is to make sure all African countries are in the Federation of Neurosurgical Society, with the aim of making to promote collaboration among African countries, sharing resources, knowledge, and expertise, which will increase the awareness of neurosurgical conditions and the rising demand for specialized care, also provide opportunities for growth. I can conclude by saying improving neurosurgery in Tanzania and across Africa requires a multifaceted approach that addresses the challenges faced by the specialty in the region. By increasing training opportunities, enhancing infrastructure and equipment, in strengthening research and collaboration, and raising public awareness, we can work towards ensuring access to quality neurosurgical care to all patients in Africa. Together, we can make a significant impact on the field of neurosurgery and improve the lives of individuals affected by neurological disorders on the continent. Thank you for your kind attention. Arigato gozaimasu. Asante sana. Thank you.
Very good.
Thank you, Dr. Grace 𝑘𝑜𝑚𝑏𝑒, for your presentation on the neurosurgery in Tanzania.
Thank you.
So I think Mrs. Grace, excellent talk. Thank you very much. So I think according to the development of the neurosurgical development in your country, I think you should follow the neurosurgeon, and also maybe as a nurse, as a neuro nurse. So you should, can you hear that you should do as a neuro nurse? Maybe also you can develop a bit separate from the neurosurgeon's work, I think.
Yes, yes, good.
Thank
you.
So,
Sylvia?
Yes, Professor Kato, thank you for such a great opportunity you have offered to Grace. As you all have mentioned, the neurosurgical skills and the practical are really developing in speed due to collaboration, but we are now struggling as neuro nurses to improve our nursing skills for the better outcome. We are now running to train more nurses to become competent in neuro care, in providing neuro care for the patient, that through training and the bedside teaching, as you normally do during the conferences. But now we are still running in shortage, but we are striving to make sure that most of the nurses are getting the exposure in the international conferences and through fellowship so that they can improve their skills in neuro nursing care. Thank you so much.
Yeah, I think anytime we can accept the neuro nurse to, of course, to our institute, but also the whole Japan neurosurgical center can accept the nurses. And also
Okay,
we
thank you
have
so
a
much,
yeah,
Professor.
and also we have a special nurse, so-called nurse practitioner, and so-called NP, so that we can go to your country and we can teach the whole year.
Yeah, that's what Professor was talking, that if we get the expert working in the institute, it's very easy to reach more nurses through that expert, that we can rotate in our neuro units, that we can get expert who will teach on the bedside according to the availability of the resources we have in our setting. Thank you so much for such opportunity as well.
Thank you very much. Thank you.
So if there's no more question, we can move on to the last speakers today, Dr. 𝑂𝑘𝑎𝑏𝑢𝑙𝑜 from Zimbabwe, to speak about his...
No, Congo, not
Congo.
Congo Republic.
About the neurosurgery in Congo.
Yeah.
Can you see my screen?
Yes, I can see it.
Yeah. Thank you so much, Kato Sensei, for this great opportunity, for inviting me to give a talk. And I know the mother knows his children. She said already, I'm from Congo. I'm from Congo, but I trained in Zimbabwe. Thank you, mother. I congratulate all the speakers. It's always difficult to speak after the big who have spoken, like Professor Yasin, May Sensei, Asaged Sensei, Grace Sensei. So I'll be the last one. I'm like the last born. So I'm going to speak about how to improve neurosurgery in my country in particular, and in Africa in general. I'm Kabulo, consultant neurosurgeon, fellow in cerebrovascular surgery at the Fujita Health University Bantani Hospital under Professor Kato. So this is Congo. Congo is the second biggest country in Africa after Algeria, after Yasin. Then in terms of population, May is the first one. Nigeria is the most populated country, and the Congo is the fourth one with more than 95 million population. This is our capital city. It's called Kinshasa. And I'm coming from a very small province close to Zambia called Okatanga province. This is my town, Lubumbashi. And Congo was colonized by Belgium, and we got our independence on the 30th of June, 1960. So far from the independence, we had 5 presidents. This is on the right, the current one. Then I did my undergrad at the University of Lubumbashi and my MEd neurosurgery at the University of Zimbabwe under Professor Kalangu. So history of neurosurgery in Congo. Neurosurgery started in 1979 by Professor Shako Junga. Shako Junga is a Congolese who was trained in Brussels, and he did his fellowship in New York. So he came back in Congo. Unfortunately, he only spent 4 years, and he died. It was a very difficult time where he was working with no imaging facilities at that time. And he died very young at the age of 48. But the moment he was practicing, he was working with a young general practitioner who got inspired, and he went to France. This Dr. Belchika, he went to France, and he did his training there, and came back in 1987 in the country. So he was the only neurosurgeon from 1987 to 2008. So the only one, and he was based in the capital city, which was he was very busy doing that. And the moment he arrived, that's when we acquired in 1988 the first CT scan machine. So, and in 19 in 2014, we acquired the first MRI machine. As you can see, neurosurgery is still a very young discipline in Congo. These were the images of the first CT scan, and these were on the right, the images of the first MRI scan machine in Congo. These are neurosurgeons, local neurosurgeons in Congo who are practicing. We are so far 21 neurosurgeons for more than 95 million population. So, and we are based in 4 towns, actually. Last time we were only in 3 towns, now in 4 cities. So we still need more neurosurgeons to cover, because people are suffering. Other provinces, there are no neurosurgeons there. So we are being helped by 3 Congolese neurosurgeons from diaspora who are coming to help us, like Professor Kalango, Professor Kalala, and Dr. 𝑀𝑖𝑘𝑎𝑒. They often come 2 monthly to practice with us here. So now we have 21 neurosurgeons. Before 2018, neurosurgery was practiced only in Kinshasa, in the capital city, and now 4 cities, Goma, Bukavu, Lubumbashi, and Kinshasa, and very soon we will have a neurosurgeon in Kisangani. So we have only 2 female neurosurgeons. This was the first one, Dr. Saram Tom, and the second one is Dr. Rosie. Now we have the third one who is going to graduate very soon from the University of Cape Town. Maybe next month he's going to complete a fellowship, a training in neurosurgery, and will join the country. So we have 3 females. So we have a society, Congolese Society of Neurosurgery, which was created in 2015. And since there are 2 Congos, Congo Kinshasa and Congo Brazzaville. So our colleagues from Brazzaville said it's difficult to create 2 Congolese societies. So they joined us. Our Congolese society includes both neurosurgeons from Democratic Republic of Congo and Republic of Congo. I always like this sentence from my friend Albert, who said, when you learn something new, your future brain will thank you. So once you stop learning and you start dying, we have to learn more. So what are we planning? So far in my town, neurosurgery is still a division under the Department of Surgery. But in Kinshasa, in the capital city, there's a Department of Surgery. That way there's a training center where they are recruiting first those who are general surgeons, and they are doing neurosurgery. I think with time, they will start to recruit now from the general practitioner to do neurosurgery. So the department is there, and the school they have 7 residents. And in Lubumbashi, Professor Kalangu is planning to open a school of neurosurgery maybe next year. So it is going to start to have 2 training centers in Congo. So our aim is to develop sub-unit of neurosurgery. We want to push young neurosurgeons to do fellowships, to do subspecialties, like I did my fellowship under Professor Kato. So she contributed a lot to our neurosurgery by training me. There is a Dr. Jeff Ntalaja who is doing endoscopy, and he has already a huge series of endoscopic pituitary surgery. So there is another one who did the endoscopic spine surgery. So we are now having subspecialties, and we are pushing more young neurosurgeons to go ahead. Like now we got again a scholarship from our chair, Dr. Tango Nobile, at the University of Cape Town. We are going to send 1 young neurosurgeon to do pediatric neurosurgery there. So in every way, we are planning maybe by from now, 5 years ahead, will be 50 neurosurgeons, because we have more than 25 residents all over in the world. Others are in Senegal, Morocco, Europe, in Brazil, and those 7 from Kinshasa. So maybe in 5 years, we will be 50 neurosurgeons. The Congolese Society is also doing some humanitarian missions. We are moving from city to city, doing spinal hydrocephalus and spinal bifida camps. So we have operated so far more than 100,000 kids. So those are the pictures from our humanitarian mission we are doing, because the population is very poor. Most of the population, they don't have in medical aids. So sometimes we are moving town to town to do those camps. So we are also under the Congolese Society of Neurosurgery organizing some conferences, international conferences. Like last year, we had the WFNS spine course, basic course, spinal committee basic course in Kinshasa, where we had more than 150 participants from about 35 countries. And next time we are organizing the CANS Congress. The continental meeting will be in Kinshasa and Brazzaville, since the society includes both from Congo, Kinshasa, and Congo-Brazzaville. And this will be preceded by pre-Congress workshop in vascular and spine. That's why we're talking about the 𝑫𝒓.𝒂𝒌𝒆𝒓 scholarship, like a giant, like Professor Kato, who is joining Kinshasa. So Talaja wants young neurosurgeons to interact with seniors, to interact with giant of neurosurgery in the world. So the course Professor Kato going to hold, it will be the pre-Congress workshop and course on vascular. So she'll be leading that. And Talaja is trying to give more scholarship to young, and we are expecting so far the awardees to be 60. And those who are going to register directly through the website, so we have more than 100 young neurosurgeons in Kinshasa to attend to this boot camp, to this pre-Congress workshop. And after this Congress, it will be the CANS Congress. So 2 days of pre-Congress workshop on vascular. Then from the 26th to 28th, it will be the actual CANS Congress. We are facing challenges in Congo with our neurosurgery. The first one is lack of access to equipment. In my town, we only acquired microscope, and they are only in private. We have 2 microscopes now, and this is with the help of Professor Kalango. He's the one who brought those 2 microscopes. He was using them to the private hospital where he works, and he allocated 1 to the private practice where I am. So I'm now having 1 microscope, the 𝑧𝒑𝒆 NC4, so where I'm doing. And in government hospital, we don't have those facilities. So we have limited number of training center. We are encouraging, like Professor Kalang want to open the 2nd training center in Lubumbashi, which is going to help by training local neurosurgeons, and also limited access to basic neuroimaging, especially in public hospitals. In private, yes, we have MRI, CT scan, but we don't have spectroscopy, we don't have angiography. So to see, like for our vascular, we are doing CT angio or MRI angio, but we don't have conventional angiography. Lack of neuroanesthetists, ICU nurses in other facilities, and neurosurgical nurses. Professor Kato trained 1 neuronurse when I was in Japan, but we still need more. I think with her help, she will help us to train more, especially from also public hospitals, so they can come and continue to train others. Lack of funds. With the major resources available being applied first to primary health care. So it's like government is more concentrated on epidemiological disease, malaria, whatever, and forgetting neurosurgery. Today, we can also talk about the traumatic brain injury, which is increasing in number in low and middle income countries. So we suppose also to put it as a priority, as a public health problem. And limited on research, because research needs money. You can start to conduct a research. You have to get a sample and send to the lab. You need money to send to the histopathology. Maybe the patient doesn't have money to go and pay that. You don't have funds to conduct that research. That's why sometimes Africa is behind about the research. And limited access to microsurgery training and the equipment. But for now, okay, it's okay. I'm there. I can do some microsurgical procedures. And the big problem in my country is late referral of patient. Those patients who are having, for example, neurological disorders, they are in the health centers, and they are referring them to us when they are already in the bed status, when the Glasgow Coma scale is dropping, when the general status is no longer good. And also poverty is one of the big challenges because people lack medical aid. So for them to get access, because neurosurgery is very expensive in my country, and it's very difficult for everyone to access to that care. This is my hospital, the public hospital, where I'm head of surgery. It is called General Provincial Hospital, Jason Sendwe. And at that hospital, imagine this big hospital, we don't have imaging modalities. So we are always transferring patients to private to do CT scan, MRI. We don't have a neuroanesthetist. I think I discussed already with Kato Sensei last time. She agreed to train 2 neuroanesthetists. They can come for fellowship. So we'll try to discuss further if we can have those, and also add more neuro nurses. So the hospital was renovated recently. Hopefully we'll get, they will also provide those modalities. But in private, we are doing most of the cases in private. We have also those microscopes in private. Like this was yesterday, I did the second bypass since I came back from Japan. It was 𝑠TA-MCA bypass, and it went very well. It was a very successful operation. I was very happy. This was the second, and the patient woke up without deficit. The patient is doing very well. The first one, unfortunately, I lost the patient. This was the second. And since I came, I've clipped already 1 aneurysm in Kinshasa. I also clipped another PCOM aneurysm here in Lubumbashi. So this is after my training under Kato Sensei in Japan. I say again, thank you to Kato Sensei. So things are now getting real this side. In conclusion, as a new discipline, as a new field in my country, neurosurgery is facing many challenges, but rapid technical and technological advances in the neurosurgical field in the past decade have revolutionized better outcomes and prognosis for patients in my country. We are also like previous speakers, they said, we need international collaboration. We need to show what we have, and we need to collaborate with others, regional collaboration, international, south-south, south-north collaboration, which is going to improve neurosurgery. We have also to do neuropolitics, means we have to discuss with our governors, we have to discuss with our ministries to allow us to use cadavers, so we can start to practice, we can have lab cadavers. So young neurosurgeons are encouraged to do subspecialties, so we can have sub-unit. So again, thank you so much to Kato Sensei, who nominated us as Fujita Health University Alumni African Branch. So very soon we are going to give you our program. We are having already our small group where we are discussing. We are going to talk about the future. What are we going to do? And we'll present to you maybe end of this month. I will have a meeting with everyone. So thank you so much, Kato Sensei. If you still remember, those clip holders you gave me, they were not toys. I'm using them. I used them yesterday to do the bypass.
Okay.
So thank you so much. I really appreciate, and I will continue to use them to make you proud. So this is my country. This is the majestic Congo River. These are some species which you can find only in Congo. All over the world, you can find them. These are monkeys called bonobo, and this is the okapi. These species are only in Congo. When you are coming in November, we are going to visit these bonobo monkeys. And volcano, unfortunately, we won't see volcano. It's far where there's a disorder. So, arigato gozaimasu. Thank you. These are my references. Thank you so much.
Thank you very much.
Thank you very much, Dr. 𝑂𝑙𝑢𝑤𝑎𝑚, for the wonderful presentation, and also on your achievement following the fellowship in Fujita.
Thank you so much.
We have a Mikan, you raise a hand. Could you speak, Mikan?
Okay. Thank you, Kabuto Sensei. It was an excellent presentation, and congrats on your second bypass. So my question: do you have this Doppler during the bypass? Do you have that in your setup, or what did you use other than the microscope? And do you have also ICG? So I am planning also to do a bypass here in Ethiopia, but I don't have this ICG and the Doppler. So if you have anything from your experience to do the bypass in this low-income country, that will be helpful. The other thing, all of the problem that you mentioned, it's also the problem in Ethiopia. So so I've written an article about exoscope as an option for microscope. It's being sent for publication. So maybe in Africa we can use, I think, this low profile exoscopes like 2D exoscopes or even the 3D low profile exoscope. It will not replace, it will not fully replace microscope or endoscope, but I think we can use that for peripheral hospitals or even for central hospitals. This 2D exoscope, I think it's a better option, and if we can start introducing it in also in Africa. Thank you.
Thank you so much, Michael Sensei. Of course, I don't have ICG. Even when I was in Japan, unfortunately, ICG was very expensive. I couldn't get ICG. So I did it without ICG, just using microscope to locate the receiver artery. And also, I got on Amazon the Doppler, the artery Doppler. I bought it when I was in Japan. So it helped me too much to locate the thing. So I have that one. And for low profile exoscope, yeah, we have already few of them. I think 3 in Kinshasa. We bought them from this guy who speaks about them, Manuel Encarnacio. He's from the Dominican Republic, and he trains in Russia. So that's the one. He comes often to Kinshasa. He was even in Lubumbashi, my town. So from him, he provided us some exoscope, and we are experiencing they are okay. So I think we'll buy more from him. Thank you so much.
Thank you. Thank you, Pablo Sensei.
Okay.
I think, do you have any comment or ideas?
Can you hear me now?
Yeah.
Okay. Thank you, 𝐺𝒔𝒄𝑒𝑙, for your nice presentation. One
Thank you so much.
simple question. What is the current situation of YNS? How much opportunity they are having to go outside the country, or your in-house training system? How you're helping your young neurosurgeons?
Okay, thank you so much. We are helping them by talking to seniors. Like, I'll give you a simple example. One day, Professor Kato asked me to present about neurosurgery in Congo when I was in Japan. And there's a professor from Oxford University. He heard about that. And he said, oh, okay, I'm available. I can train someone in Scout-based. So we got already that opportunity of sending that one. So we are pushing them. But the problem is lack of fund. If we get scholarship, then they can go and do that. So for now, like we got a scholarship for Cape Town. So there's one who is going there to do pediatric neurosurgery. Yeah, so we are trying to talk with seniors, with Giant to help us so we can choose. And we are trying to see who does this better, who can do this. So we collaborate. Since we are just few, we are only 21. So we are having 2 meetings per month, and we discuss on how we can push everyone to go and do subspecialty. So that's the means we are using to do so.
Yeah, I think it is very important, because sometimes the young neurosurgeons does not know where to go, how to go. In that case, we can promote them. This is the way to go abroad. This is the way to get a free fellowship or other sort of things. I think we can help this in this regard, like we are doing in our country, in Bangladesh. Thank you.
Wow, thank you so much, Dr. Atike. Thank you.
Yeah, thank you.
Could you unmute,
Sorry.
Professor?
Yes, yes. So thank you, Kablo. Excellent talk. So anytime we can accept we are neuronurse and also the anesthesiologist, the training at the institute. So just you can send us because
Thank you so much, Kato.
yes. I think not only the neurosurgeon but also the nurse and the anesthesiologist. The three components is very important to improve the patient, the result and the quality, you see. And,
of course, thank you so much, Kato Sensei. I will come back to you later on. I'll text you.
Yes, please write to me.
Thank you.
Hi.
So,
any question from you?
no,
comment?
I don't have any question on the presentation.
Dr. Liu, are you with us now? Please say, Maska? No answer.
No.
No. So I think we can make a summarize maybe during the webinar. The Dr. Liu asked some question to all speakers. I think then you can reply to Dr. Liu.
Yes.
Then we can summarize. Maybe I think we can visit your place and maybe annual congress, the biggest congress. I think that is most efficient to discuss and maybe show some cases, discussion, everything. So just write back to the Dr. Liu, please.
Oh, Felicity, you have some words?
Yes, thank Dr. Kaburu for her presentation. So,
I can't hear. Mute, please. Okay.
Sorry. Yes. I want to thank Dr. Kaburu for his wonderful presentation, and I think we have almost the same problem here in Africa. And I want to ask why we don't have so much of a neurosurgeon in Africa. Did you think that new generation is not interested in neurosurgery, or what? What do you think?
Okay, thank you so much, Yasin Sensei. No, now new generation is more interested in neurosurgery, but before people were not interested because we didn't have equipment. People were only doing basic surgeries like appendectomy, general surgery, yes, but that time Africa was behind, very behind, and we didn't have facilities for neurosurgery. Who could do neurosurgery? Then you come back in your country, you don't have a CT scan machine. How are you going to practice without CT scan? But now people are now being interested in neurosurgery because we have now those facilities. Like my town, I will give you a simple example. In my town, Lubumbashi is the second biggest city in the country. When I was in training doing my undergrad, there was no CT scan. And I left my country in 2013 to go to do my MED. That's when the first CT scan machine came. And there was no neurosurgeon. The first neurosurgeon, as a local permanent neurosurgeon, came to my town in 2019. So I think now people are getting interested because we can have few things to help neurosurgeons to work. But before it was very difficult. Like I said, for us in 5 years, we'll be 50 neurosurgeons. Mm-hmm.
Mm-hmm.
Yes,
because I think the first thing to do is to increase the number of neurosurgeons here in this continent with of course, a good quality of education.
And training centers. If we have more training centers, we can collaborate. We can invite. Imagine if we get our training center in Lubumbashi, we open. We can invite Kato Sensei to come and give a lecture. We can invite Yasin Sensei to come and give lecture. You see, when we are collaborating like this, we can help those who are being trained instead of leaving the country, go far without funds. it will be very easy to get a teacher from far because he's one to come and teach, you see. So we have to encourage also opening of training centers.
May, you have comments or questions?
Yes. I just wanted to comment. Can you hear me?
Yes.
Okay, good.
Yes.
So that you comment on Dr. Kabule's presentation. That was an awesome presentation, Dr. Kabule. Thank you so much. And I think that, just like you have said, most of the challenges you mentioned are the things that we see basically in sub-Saharan Africa. And these collaborations we're talking about is very, very helpful to help us improve. And congratulations on the amazing and the MCA bypass. I'm going to start that very soon, and you will come to join me. Thank you.
Thank you so much, May.
Dr. Aniaku, please. I can't hear your voice. Not yet. Oh. I'm sorry, Aniaku, I can't hear your voice now. Professor Kato,
does he have, maybe we're not hearing him. Maybe he connected his earphones on the computer without putting them on the ears.
So maybe Dr. Liu, maybe if you are with us now, just you can the final comment, please. Okay.
Yeah, so sorry everyone. Yeah. Thank you, Professor Kato.
Always in the car. Okay.
Yeah.
So busy.
So yes. Thank you for all our speakers and your great work. I see a lot of work has been put in by presenting in this meeting, and I hope we can continue working together. Definitely, African continent is one of the important for neurosurgery for the ACNS. Thank you, everyone. Thank you, Professor Kato.
Thank you very much.
You're welcome.
Maybe we can make summary so that we will send it to everybody. Okay, Dr. Liu.
Sure, Prof.
Okay, thanks. So, Dr. Hui?
Yeah.
Final comment?
I highly appreciate all the speakers today from different countries in Africa to present about the situation in neurosurgery in their places. And I believe that with firstly knowing the problems in different parts of the world, and then we can work together, we can discuss together, and we will find a solution or the orientation to cope with that and improve neurosurgery in our countries, in our regions, and even across the world. So thank you very much again for presenting. And maybe I will invite Professor Kato for the final and closing the webinar.
Okay. Thank you so much. So already I discussed with email. So please send your hi. So please send your neuronurse and also anesthesiologist and also your junior to Japan. Maybe we can take care of them. Yeah, take care of them well.
Thank you.
Yes.
Thank you so much.
Then, or sometimes I talk to Yashin, maybe that in future, the more and more less invasive treatment in the world, not only Japan, not only the developed country. I think endovascular is one of the good, very important subject. I think I asked Yashin come back to Japan again. So we have so many endovascular cases. Now in Japan is less and less for the residents take surgical side because they hate so much the hard work, long working hour. So I think less salary, something like that. So that means I think minimally invasive treatment you should learn, please. Even Africa, I think. Thank you so much.
Thank you.
Kato Sensei, with your permission, can everyone open his camera so I can get a screenshot?
そうですね。はいはい。That's a great idea. But what's the temperature? Because you wear so thick clothes. Very hot.
No. It's cold this time. It's winter.
Winter time
Yeah.
now. Okay.
Yes.
Hi.
Okay, everyone can open. I want to get a screenshot.
How do we do it? Where should I open it?
You open your camera, just press where it is written video on your bottom left.
Okay.
Great. Madam Sylvia. Okay. Let me get the shot. Great. It's done. I will share it.
Hi. Okay. Thank you. ありがとうございました。
ありがとうご
ありがとうござい
ま。
ますす。
ありがとうございます。
はい、ありがとう。See you next time, please.
Bye.
Okay.
Thank you.
Bye bye.
So